What is botulinum toxin? Well, in the United States, there are 5 different products that are FDA approved. Botox, Dysport, Xeomin, Jeauveau, and the newest one, Daxxify. These are all botulinum toxin products, and they're used to treat wrinkles. And the way that they treat wrinkles is that it stops the movement that causes lines on your face. So the typical areas that we treat are your glabella, which also known as the number 11 lines, which are caused by the muscles that do this, and in other areas of forehead, and this is the frontalis muscle, which helps to raise our forehead, but it also creates these horizontal lines, and then the crow's feet area, and these lines that form when you smile are caused by a ring of muscles around your eyes. And if we immobilize these muscles or relax them by injecting the muscles with botulinum toxin, then we stop that motion that creates those lines. And more importantly, it prevents those lines from being engraved into your skin, because if you keep making certain movements, those lines get reinforced and they'll become permanent features of your face. And that's why we like to treat those with botulinum toxin. So what are the risks of botulinum toxin? So first thing, we need to realize that botulinum toxin is a toxin, and the reason that it's a toxin and that it could be dangerous in large doses is because if you had a massive dose like you would with botulism food poisoning, the protein or the toxin will stop the movement in all the muscles in your body, including the muscles that we use to breathe and to swallow. So that's why if you get botulism or botulinum toxin poisoning, you could actually die from it. Why would we use this for cosmetic treatments? Well, when we're using it for cosmetic treatments to treat the wrinkles, if it's used appropriately, it is very safe because we are using such a tiny dose that even if you injected the amount that we're using on the whole face right into the diaphragm, it probably would not be enough to cause any kind of dangerous effect. And so life-threatening poisoning from botulinum toxin treatments for cosmetic wrinkles, it's very unlikely. More likely are common side effects like allergic reactions that you can have with anything, whether it's a vaccine or an antibiotic or any medicine. You can have an allergic reaction, which could happen with botulinum toxin as just like anything else, but the risk isn't really any greater than getting an injection or a vaccine. So, but more commonly, the type of side effects that could happen are more cosmetic things like drooping, because it works on the muscle and prevents the muscle from moving. If you overdo the forehead, these muscles, they cause these wrinkles, but they also hold the forehead up. So if you do too much, you can cause a brow droop, okay? And that's a very common side effect. Another side effect is you can get what's called a ptosis, where an eyelid will drop down like that, okay? And those type of side effects are common, especially if it's done by somebody that's not really experienced doing, although it could happen even with experienced injectors. They sometimes happen for various reasons. But sometimes we can counteract that by injecting other muscles to counteract the effect of the muscles that we injected. But sometimes we just have to wait for it to wear off. There are some eye drops that can help with the ptosis. If you inject too much under the eyes, sometimes you can get, the eyes could droop and you might not be able to close it properly. But the other things that actually the most common thing is bruising. You could get bruising from the needle, not from the product. And if you're getting botulinum toxin injections regularly, at some point you will get a bruise. And usually they can be covered up. You can take Arnica montana, which is an herbal product, and if you get the little pellets and start taking it beforehand, like the day before, take it like 3 times a day, put it under your tongue, that can help to prevent bruising. You can also get the gel that you can rub onto the bruise. That helps it go away faster. If you do develop a bruise, a lot of times we could use an IPL or pulse light treatment to break up the bruise and make it go away faster. So those are things that can be done. The other type of side effects that we need to worry about if you're injecting in areas that are off-label, the on-label areas where the FDA approved areas are here, the number 11 lines, the forehead lines, and the crow's feet. But off-label, which means they're not officially approved by the FDA, but we're allowed to use it because it's kind of a similar treatment in a different area, are the lower face. Sometimes you can treat these muscles that pull down the side corners of your mouth, and that can help lift up a little bit. You can use it for these, like the chin, like the peach pit appearance of the chin. You can use it to treat the platysmal bands, the vertical bands. Now you do have to be careful when you treat these bands, because if you do too much in that area, it could affect your swallowing muscles. So that's why it's very important to have a properly trained and experienced injector. If you're being injected by somebody who knows what they're doing, it's a very safe treatment, and the effects could vary depending on the skill of your injector. So there is some artistic skill required too, because your injector is injecting the muscles to create a certain effect, and you don't see the results for a week. So it's kind of like painting with invisible ink. So that's where the experience really comes in, because the injector cannot see the effect of the treatment until it kicks in a week later. So they really need to know from experience and from proper training which muscles and where and how much to inject. So that's a quick spiel on botulinum toxin. I'm Dr. William Song from Omni Aesthetics.